Okay, we're going to do the comprehensive assessment of Miss Tina Jones. She's a 28-year-old pleasant African-American female who presented to the clinic for a pre-employment physical. She's the primary source of information and she is reliable. These are her vitals. We're going to assess for orientation. We're going to ask her what is your name, her name and date of birth.
My name is Tina Jones, and I was born on February 17th.
Okay, we're going to ask her what building is she in.
I'm at the doctor's office. It's Shadow Health General Clinic.
And we are going to ask her what is the date and year.
Today's date is...
Okay, and she is alert and oriented ×3. We're going to inspect her head. Hair growth is even, it's thick, and there is no signs of infestation. We're going to inspect her eyelids, first the upper. Okay, now the lower. The conjunctiva is pink and moist. Now we're going to inspect the eyes. First the right. Okay, sclera is white. There's no injection, no drainage, no visible abnormalities noted. We're going to check for light accommodation. The pupil is reactive to light. Let's check the left eye. Okay. That pupil is also reactive. I'm going to check the fundus. Looks good. The disc margins are sharp. Veins and arteries look good. You can see the cotton wool bodies over there. Okay. Let's check the left eye now. Fundus looks good. Sharp disc margins. Okay. Looks good. So in the right eye, there's a little bit of retinal changes, but overall looks good. I'm going to check eye movements now. We're going to tell her to follow my finger.
Okay.
Okay, no extraocular movement noted. And convergence is good. We're going to check peripheral vision now.
Okay, I will. Now.
And peripheral vision is good. We're going to check visual acuity.
DEFPOTEC. I can't read that line. It's too little. DEFPOTEC. I can't read that line. It's too little. DEFPOTEC.
P-O-T-E-C. I can't read that line. It's too little.
She has 20/20 vision in both eyes. Okay. The right nostril is pink and moist. The nostril is patent. There's no drainage noted. No foreign bodies noted. And same for the left. Now let's check the ears. No redness, no erythema, no drainage, no cerumen. The tympanic membrane is pearly gray, and the cone of light is at 5 o'clock. Looks good. Left ear. No redness, no erythema, no drainage, no cerumen. The cone of light is at 7 o'clock, and the tympanic membrane is pearly gray. Looks good. I'm going to do the whisper text. First, the right ear.
F.
F.
8.
8.
W.
W.
Okay, now the left ear.
4.
4.
R.
R.
9.
9.
Okay, her hearing is intact. I'm going to inspect her mouth. Mucous membranes are pink and moist. Uvula rises as it should. Tonsils are 2+ bilaterally. No erythema noted. Dentition is good. No ulcers or sores noted. Tongue movement is good. And her gag reflex is intact. Okay, we're going to palpate her scalp. Okay, no masses noted, looks good. Going to palpate her sinuses. First the upper, no tenderness noted. And now the lower. Also no tenderness. I'm going to palpate the cervical lymph nodes. Okay, and this supraclavicular, and there's no palpable nodes. I'm going to palpate TMJ. I'm going to ask her to open and close her mouth. She's got full range of motion and no clicking noted. I'm going to palpate the thyroid. It is smooth, no nodules, and no goiter. We're going to auscultate the carotids. First the right, no bruit, and the left, no bruit. We're going to assess range of motion of her neck. Okay. And she has full range of motion. I'm going to palpate the carotids. First the right. Two plus with no thrill. And now the left. Also 2 plus with no thrill. And we're going to check her neck strength. Her neck strength is good, 5 out of 5. And last one. Okay, now we're going to do the anterior chest. We're just inspecting, no abnormalities noted.
Normal. 99. Normal.
'Normal. Okay. Everything sounds good. Lungs are clear. No adventitious sounds noted. I'm going to listen to the heart now. S1 and S2 noted. No murmur noted. S1 and S2 are noted. No extra beats. No murmurs, no rubs, no gallops. No palpate for the axillary lymph nodes. No palpable nodes noted.
$99.
No fremitus noted. Good fremitus noted. We're going to percuss. And all areas are resonant. And that is her spirometry reading. Now we're going to do the posterior chest. Check for CVA tenderness. And no tenderness noted. The patient did not react. Skin looks good. There's a little bit of freckle on her right upper back there. I'm going to check for firmness.
99. 99. 99.
Okay, and it is equal. I'm going to check for asymmetry. And her chest, posterior chest rises symmetrically. Percussion. And all areas are resonant.
Lovely. 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 Lovely.
Lung sounds are clear. They're present in all lobes. There's no crackles, no wheezing, no adventitious breath sounds. We're going to check her abdomen. First, we're going to inspect. Abdomen is protuberant. She has increased hair growth below the umbilicus. Striae is present. We are going to auscultate the abdomen. Bowel sounds are present in all quadrants. They're normal active. We're going to auscultate first the aorta. No bruit noted. The right renal artery, no bruit. Left renal artery with no bruit. Right iliac with no bruit. Left iliac with no bruit. Right femoral, no bruit. And left femoral with no bruit. Okay, we are going to palpate with light palpation. Abdomen soft, no masses, no tenderness. Okay. Deep palpation, no masses noted, no tenderness. The liver is palpable 1 centimeter below the right costal margin. That's normal. The spleen is not palpable, which is normal. The right kidney, not palpable, no masses, also normal. And the left kidney, not palpable with no masses. We're going to percuss the liver. The liver is 7 centimeter MCL on percussion. That's normal. We're going to palpate the spleen. Wait a minute. Spleen palpated, no dullness. Palpating for PMI. It is non-displaced, no heaves and no lifts. That is normal. Okay, we're going to check the upper extremities. We're going to check the pulses. The radial pulses. They're 2+. on the right. And 2 plus on the left. Now the brachial. 2 plus on the left. And 2 plus on the right. We're going to check the capillary refill. Capillary refill on the right hand looks good, less than 3 seconds. And capillary refill on the left looks good, less than 3 seconds. We're going to check the motor reflexes or the motor skills on the finger to nose. So we're going to ask her to close your eyes. And touch her fingers to her nose.
I can do that.
Okay, it's smooth. Bilaterally, it looks good. I'm going to check our hand movements. And check alternating movements.
Okay, like this?
And she did well. Okay, we're gonna check her sensation to dull, sharp, and soft touch.
Dull. Dull. Soft. 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 Sharp. Sharp. Sharp.
Okay, she did well with that. Now we're going to check her position sense with her fingers.
Okay, I will. Up.
Down.
And her position sense is intact. I'm going to check her reflexes now. Her DTRs for the right brachioradialis is 2+. The right biceps is 2+. And the right triceps is 2+. That's all within normal limits. Now the left. And they are all 2+ and normal. I'm going to check graphesthesia.
Okay. That's an A. A figure 8.
And it is intact. Stereogenesis.
Okay, sure. That feels like a key. This is some wire thing. Paperclip? Some kind of coin.
Okay. Left hand is good.
The paperclip again. That feels like a key. Some kind of coin.
And the right hand is good. We're going to check her strength in her biceps. Strength is 5 out of 5 in her biceps. Check her hand strength. And she is 5 out of 5. And her shoulders are 5 out of 5 as well. Now range of motion, adduction and abduction. Extension. inflection, and she has full range of motion. Now her elbows, flexion and extension, and supination and pronation. And again, full range of motion. Now her shoulders, adduction, extension, and flexion. And she has full range of motion of her shoulders. And the last thing is to inspect her fingernails, and there's no ridges or abnormalities found. Her lower extremities, let's check for edema. And there's no edema noted in either leg. I check her pulses. Femoral pulses are 2+. On the right, 2+ on the left, that's normal. Right popliteal is 2+. Left popliteal is 2+. Right posterior tibial, 2+. Left posterior tibial is 2+. Right dorsalis pedis is 2+. And left dorsalis pedis is 2+. So her peripheral pulses and her lower extremities are all within normal limits. I'm going to check her capillary refill in her toes. Right toes. Capillary refill on the right foot is good, all less than 3 seconds. And capillary refill on the left is good, less than 3 seconds. We're going to check her motor skills with heel to shin. We're going to ask her to run her foot down her shin.
Sure.
Okay. Now we're going to ask her to do the other one.
Okay.
And her motor skills are good. No deviation was noted. And we're going to check her sensation to touch on the lower extremities.
Okay. Dull. Dull. Sharp. Sharp. Soft. Soft.
And her sensation to touch is good. I'm going to check the position sense of her toes.
Okay, I will. Down. I think that was up.
And her position sense is intact. We're going to check monofilament.
Okay, I will. Yes. Yes. Yes.
And she has diminished sensation to bilateral feet. We're going to check her reflexes. Her right patella first. It's 2+, which is normal. Her right Achilles. Which is 2+ and normal. To her left Achilles. Also 2+. And we'll do the left patella. Okay, also 2+. I'm going to check her knee strength. Strength is 5 out of 5. Her ankle strength. Also 5 out of 5. Hip strength. Five out of 5, all normal. Now range of motion. Eversion and inversion. Okay, full range of motion. Extension and flexion. With full range of motion. Now the hips, abductor, with full range of motion, adductor, with full range of motion, extensor, with full range of motion, and now flexor. With full range of motion. Extension of the knees. And flexion. With full range of motion. And inspect her toenails. No ridges or abnormalities noted. And we're going to check for range of motion of her spine. And that is it. Miss Jones has completed her comprehensive assessment. She has passed, and there is no reason why I see why she could not enjoy a full career at her new job. Thank you.